It's December. COVID-19 is spreading in China. The world is watching with caution. Does that sound like a déjà vu? Well, 3 years after the virus first emerged, it's almost like we're going back to stage one. Let's take a look at what's happening in China. What is the situation like? The residents of Shanghai are lining up outside fever clinics. They are trying to stock up on medicines. Delivery workers are back in high demand. People are ordering in to avoid contracting the disease. China reported 5 more deaths on Tuesday, but the low tally so far has not been in line with projections. So could China be fudging the numbers? They haven't officially declared even 6,000 COVID-19 deaths since the pandemic started. Yet reports saying that there are lines at crematoriums across the country. China, of course, has tried to play down the concerns. Here are some health officials at a news conference on Tuesday.
Deaths caused by pneumonia and respiratory failure after contract COVID-19 would be classified as COVID-19 deaths. Deaths caused by other underlying diseases, such as cardiovascular disease, resulting in death for infected people, will not get that classification.
The accurate tallying of deaths in China is not the only concern. There's also the worry about what happens when it spreads. And most of China's population has taken the indigenous vaccines. These are seen as less effective in stopping the virus than the foreign ones. The Omicron variant is especially adept when it comes to bypassing the Chinese vaccines. So what happens as COVID-19 makes its way through the population when it gets the chance to mutate? Again, Chinese health officials try to calm down the public.
It is relatively unlikely that the virus will increase both its contagiousness and lethality at the same time. Will a new strain of both greater transmission and lethality appear? This possibility is even smaller.
China withdrew its zero-COVID policy after protests around the nation. But is it prepared for what happens when it opens up? Does the government have an action plan? Or will a variant from China bring the world to its knees once again? The rest of the world is watching. They have offered to send China mRNA vaccines, but negotiations are still underway. China has insisted that its local vaccines are an effective countermeasure. Importing vaccines may make the government and, of course, Xi Jinping look bad. But while the Chinese government plays the vaccine politics, the world is at risk once again. We just opened up after 2 years of isolation. Understandably, no one wants to go back to how things were. But perhaps we can use our past learnings to be better prepared. So we ask, is it time for the masks to return, for hospitals to prepare, oxygen cylinders for testing to become more prevalent? Because after all, prevention is better than cure, and new COVID-19 waves originating in China should not be taken lightly. For more on this, I have with me Dr. Benjamin Cowling from Hong Kong. He is the Chair Professor of Epidemiology at the School of Public Health at the University of Hong Kong. Thanks very much for being here. Now, I have to begin by asking you for your assessment of how serious the situation in China really is right now, looking at the reports coming in, and how bad could it get?
I think we should be very concerned about the situation in China because in the last 2 weeks, since they relaxed the COVID measures for the zero COVID policy, there's already a very substantial surge in transmission, a very substantial surge in infections, and most likely within the next 1 to 2 months, the majority of the population will have COVID because it's spreading so fast, so quickly across the country. But we recognize that most people who get COVID will have very mild symptoms, just lasting for a few days. It's typically a very mild infection, but in a small minority of cases, particularly in older people and those with underlying medical conditions, it can be more severe. And that's the concern, because when you have just a small proportion with a large number of infections, that small proportion can still be quite a big number. And so our concern is for whether the hospitals can cope with such a large number of infections in a short space of time. And it looks like there's going to be a struggle this winter for the hospitals to manage.
Right. There is a serious concern about the emergence of new variants as a result of the spike in cases in China. What is your assessment on that?
Within the next 1 to 2 months, there's likely to be a very large number of infections across China. And every time the virus has an opportunity to evolve, that's the possibility that a new subvariant or new variant could emerge. And with hundreds of millions of infections, that's a lot of opportunities to evolve. But at the same time, in other parts of the world, there's many, many COVID infections right now in India, in other parts of Asia, in Europe, United States, elsewhere. Many infections are occurring every day. So it's not like the virus is not already having a lot of opportunity to evolve. But of course, within a short space of time, it's quite possible that the virus will find a new direction to go from the infections that are going to occur in China. And we have to be alert to that possibility and prepared that there may be another, maybe subvariant or maybe even a new variant that comes out of China and spreads around the world. So continuing to do virus testing and virus sequencing is really important, so we get as early warning as possible if that were to happen.
Right. If you can elaborate on that, how can the world be better prepared to deal with this, considering the lessons that we learned, and to not allow a repeat of the 2020 situation?
But if you remember back to maybe 18 months ago when the Delta variant was sweeping around the world, we thought that was approaching the end of the pandemic. And by maybe September of last year, we thought maybe we won't have much more to worry about. And then the Omicron variant appeared and swept around the world with repeated waves, causing a lot of infections, mostly mild. But still, Omicron has caused a lot of deaths around the world. There's still people who are vulnerable in our communities. There's still measures that can be taken. If a new variant were to emerge now, we'd have yet another challenge to face in the coming months. And maybe the coming winter in the Northern Hemisphere. We can take actions, for example, having booster campaigns to increase immunity in our older adults, because that immunity may have been waning in recent months from their previous doses. We can think about maybe even some public health measures if the situation requires. Hopefully that won't be necessary, but we need to keep an eye on the situation and we need to be ready to deal with whatever does happen. Hopefully we won't have any further challenges with this particular virus, but it pays to be prepared.
WION now available in your country. Download the app now. Get all the news on the move.